My name's Professor Ewan Griffiths. I'm a specialist upper GI consultant surgeon, and I work in my NHS practice in Birmingham, but also privately at the Priory Hospital and the HCA, the Harborne Hospital. Today I'd like to talk to you about hiatus hernias, which are increasingly common. I'd like to talk to you about what is a hiatus hernia. Effectively, a hiatus hernia is when the stomach rises up through a small hole in the diaphragm, and this has the effect of weakening the valve, which normally keeps acid in the stomach. So patients often complain of symptoms of heartburn or acid indigestion or regurgitation of food contents, and this is an increasingly common problem in our society. Other symptoms if the hernia is really big include patients may vomit or regurgitate food, or even develop chest pain, or even more serious complications from the hiatus hernia, such as twists. I'd also like to talk about the two types of hiatus hernia, because there's effectively two main types of hiatus hernia. The commonest is a sliding hiatus hernia, where the stomach just slides up into the chest. And patients with this sliding hernia tend to present with acid reflux type symptoms. Probably the more serious type is a type called a Paraesophageal hernia, which can cause patients to have difficulty swallowing or vomiting or chest pain. And that's really why it's important to investigate patients with hiatus hernia symptoms to see which type they've got and see which treatment options are available for them. Investigations for hiatus hernias. Common investigations include endoscopy, which is where a small camera is placed through the mouth or occasionally through the nose to investigate the esophagus, stomach and duodenum, and surgeons or gastroenterologists can get a good view of the inside of the patient's anatomy to diagnose hiatus hernias or the complications of hiatus hernias. Other investigations for hiatus hernias include a barium swallow, which involves the patient drinking dye in front of an X-ray machine. This is often supervised by a radiologist who will get the patient into different positions to see the dye going down the gullet into the stomach and see what type of hernia it is and whether the stomach's twisted or not. And depending on symptoms, patients may need other investigations such as manometry, which is a special pressure test of the esophagus to see how well the esophagus contracts, or they may need to wear a small pH probe for 24 hours to see how much acid's coming up the esophagus and whether the hiatus hernia is actually causing their symptoms. And some patients may need a CT scan. In terms of treatment options for hiatus hernias, these can be broken down into just lifestyle measures and common things to improve reflux or symptoms from a hiatus hernia, including changing lifestyle, such as avoiding large meals or avoiding eating late at night, propping your head up at night using either a wedge pillow or putting something under the bed to raise the head of the bed. Other options include medications that come from the pharmacy, such as antacids. Common ones include Gaviscon or Rennies. And patients may need to see their GP for better medication, which actually reduce the acid in the stomach. And these are medications called proton pump inhibitors, such as omeprazole or lansoprazole, or H2 blockers, such as famotidine. And then the third treatment option for patients with a hiatus hernia is surgery. And this is the operation I specialise in. I did a year in Australia working in a high volume unit which performed lots of hiatus hernia surgery. And this operation can commonly be performed keyhole. So patients either have a day case procedure or a short overnight stay. It involves full general anaesthetic and about 4 or 5 cuts which are small to the abdomen, and the surgical procedure aims to move the stomach back into the abdomen repair the defect in the diaphragm with some permanent stitches, and then forming a new valve or a wrap, it's also called a fundoplication, to try and anchor the stomach in the abdomen to try and limit recurrence, but also to reduce acid going back up into the esophagus to treat the symptoms. This is a specialist operation, and it does have some pros and cons, but it's generally very safe, has a low risk of needing open surgery, a low risk of any injuries. Patients do need to use a special diet sheet for the recovery in the first couple of months after the operation to make sure food goes down, as often the surgery can make the top of the stomach and esophagus bruised and swollen, and this needs time to settle. Ongoing difficulty swallowing is actually very rare, particularly when the wrap is modified to just be partially around the stomach and not a full wrap. So in summary, hiatus hernias are very common. Luckily, most patients don't need surgery, but if they do, make sure you go to a specialist surgeon who can investigate you properly and give you the up-to-date pros and cons of having the operation depending on your exact medical circumstances. Thank you for listening. I hope you found this informative.